Question 1. System analysis indicates that a client with a diagnosis of alopecia areata has requested a custom-fitted hairpiece. The barber is considering various methods for attachment and styling. Which of the following approaches best prioritizes client safety and well-being while addressing the client's request? Option A. Immediately select a standard pre-made wig and proceed with a strong adhesive attachment to ensure a secure fit, as this is the most common method. Option B. Recommend a synthetic hairpiece that requires significant heat styling to achieve the desired look without inquiring about the client's scalp sensitivity. Option C. Conduct a thorough consultation to discuss the client's specific scalp condition, explore hypoallergenic hairpiece materials and attachment methods, and perform a patch test for any adhesives or tapes before proceeding with fitting and styling. Option D. Proceed with fitting a hairpiece using a standard tape adhesive, assuming the client's scalp will tolerate it without any prior testing. The correct answer is C. Conduct a thorough consultation to discuss the client's specific scalp condition, explore hypoallergenic hairpiece materials and attachment methods, and perform a patch test for any adhesives or tapes before proceeding with fitting and styling. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a client with a specific medical condition, alopecia areata, and a desire for a hairpiece. The barber must balance the client's aesthetic goals with the need for safe and hygienic practices, especially when dealing with a sensitive scalp and potential for skin irritation or infection. The risk of improper fitting or attachment could lead to discomfort, damage to the client's natural hair or scalp, or even allergic reactions. Correct approach analysis. The correct approach prioritizes a thorough consultation and assessment before proceeding with any service. This aligns with best professional practice by ensuring the client's needs and any contraindications are understood. It involves discussing the client's specific condition, exploring suitable hairpiece options that minimize scalp irritation, and performing a patch test for adhesives or tapes. This proactive approach mitigates risks, ensures client satisfaction, and adheres to the ethical duty of care expected of a licensed barber. It also implicitly follows general health and safety guidelines that would be expected in any regulated service industry, focusing on client well-being and preventing adverse reactions. Incorrect approaches analysis. One incorrect approach involves immediately selecting and fitting a standard wig without understanding the client's alopecia. This fails to acknowledge the potential for increased scalp sensitivity and the need for specialized materials or attachment methods. It risks discomfort, irritation, and a poor fit, potentially exacerbating the client's condition or causing distress. This approach demonstrates a lack of client-centered care and a failure to assess individual needs. Another incorrect approach is to proceed with a strong adhesive without a patch test. This is a significant regulatory and ethical failure. Adhesives can cause severe allergic reactions or skin damage, especially on a compromised scalp. Failing to perform a patch test is a direct violation of the duty of care and could lead to serious harm, resulting in potential legal and disciplinary action. It disregards fundamental safety protocols for skin contact products. A third incorrect approach is to recommend a hairpiece that requires extensive manipulation or styling that could irritate the scalp, without first consulting with the client about their comfort levels and any specific sensitivities related to their alopecia. This overlooks the client's well-being in favor of a potentially complex styling outcome. It demonstrates a lack of empathy and a failure to prioritize the client's comfort and scalp health throughout the service. Professional reasoning. Professionals should always begin with a comprehensive client consultation. This involves active listening to understand their needs, concerns, and any relevant medical history. Following the consultation, a risk assessment should be conducted, identifying potential hazards and contraindications. Based on this assessment, appropriate solutions and techniques should be selected, always prioritizing client safety and comfort. Regular review of services and client feedback is also crucial for continuous improvement and adherence to best practices. Question 2. When evaluating a client's scalp during a consultation for a haircut, a barber notices a raised, irregular, and discolored mole that has recently appeared. The client mentions it has been itching. What is the most appropriate course of action for the barber? Option A. Advise the client to consult a physician or dermatologist for a professional medical evaluation of the mole. Option B. Suggest the client use a home remedy to reduce the itching and monitor the mole for a few more weeks. Option C. Proceed with the haircut as planned, making a mental note of the mole but not mentioning it to the client to avoid causing alarm. Option D. Apply a medicated shampoo to the area, believing it might be a fungal infection that can be treated with barbering products. The correct answer is A. Advise the client to consult a physician or dermatologist for a professional medical evaluation of the mole. Explanation: scenario analysis. This scenario is professionally challenging because it requires the barber to identify a potential underlying medical condition based on visual cues observed during a routine service. Misinterpreting these signs could lead to improper treatment, delayed diagnosis, or even harm to the client. The barber must balance providing a service with recognizing the limits of their professional scope and the importance of client safety and well-being. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing client safety and adhering to regulatory guidelines. Recognizing that a skin lesion could be a symptom of a more serious condition, the barber correctly advises the client to seek professional medical evaluation. This aligns with the ethical responsibility to avoid diagnosing or treating medical conditions beyond the scope of barbering practice and to refer clients to appropriate healthcare providers when necessary. This approach upholds the principle of do no harm and ensures the client receives the correct care. Incorrect approaches analysis. One incorrect approach involves attempting to treat the lesion with barbering products or techniques. This is a regulatory and ethical failure because it constitutes practicing medicine without a license, which is illegal and dangerous. Barbering regulations strictly prohibit diagnosing or treating medical conditions. Another incorrect approach is to ignore the lesion and proceed with the service as if it were not present. This is an ethical failure as it disregards a potential health concern for the client and could lead to the lesion worsening or spreading. It also fails to uphold the duty of care owed to the client. A third incorrect approach is to offer a casual opinion about the lesion without recommending professional medical advice. While not as severe as attempting treatment, this still falls short of best practice. It can create a false sense of security for the client or cause undue anxiety without providing a clear, actionable step for proper care, potentially delaying necessary medical attention. Professional reasoning. Professionals should develop a systematic approach to client assessment. This involves observing the client's skin and hair for any abnormalities during the consultation and service. If an abnormality is detected, the professional should document their observations, and if it appears to be a medical concern, advise the client to consult a qualified healthcare provider. They should clearly state that they are not qualified to diagnose or treat medical conditions. This decision-making process prioritizes client safety, adheres to professional scope of practice, and ensures compliance with relevant regulations. Question 3. Governance review demonstrates that a client has requested a specific haircut that, based on your professional assessment of their hair type and face shape, is likely to be difficult to achieve successfully and may not be flattering. The client is insistent on this particular style. What is the most ethically and professionally sound approach to this situation? Option A. Perform the haircut as requested but subtly alter the style to what you believe is a better look, without informing the client of the changes made. Option B. Immediately refuse to perform the requested haircut, stating that it is a bad idea and you will not do it, without further discussion or offering any other options. Option C. Politely explain your professional concerns regarding the suitability of the requested haircut for their hair type and face shape, and offer alternative styling suggestions that you believe would be more flattering and manageable, while still aiming to achieve a similar aesthetic goal. Option D. Proceed with the client's requested haircut exactly as described, without offering any professional opinion or alternatives, to ensure client satisfaction with their stated preference. Correct answer is D. Proceed with the client's requested haircut exactly as described, without offering any professional opinion or alternatives, to ensure client satisfaction with their stated preference. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in client autonomy versus professional judgment. A client is requesting a haircut that, based on the barber's expertise and understanding of hair types and face shapes, is likely to be unflattering and difficult to maintain. The barber must navigate the ethical obligation to respect client wishes while also upholding professional standards and ensuring client satisfaction in the long term. This requires careful communication and a balance between client preference and expert advice. Correct approach analysis. The correct approach prioritizes open communication, professional consultation, and client education. By explaining the potential challenges of the requested cut for the client's specific hair type and face shape, and offering alternative suggestions that align with the client's desired aesthetic while being more suitable. The barber demonstrates best professional practice. This approach respects the client agency while leveraging their expertise to achieve a positive outcome. It aligns with ethical principles of informed consent and professional responsibility to provide competent service. The barber's role is not merely to execute a request, but to advise and guide the client towards a result that enhances their appearance and is manageable. Incorrect approaches analysis. One incorrect approach involves immediately refusing the client's request without offering alternatives or explanation. This demonstrates a lack of client-centered service and can be perceived as unprofessional and dismissive, potentially violating the implicit agreement to provide a service based on consultation and skill. It fails to uphold the ethical duty of care and client respect. Another incorrect approach is to proceed with the client's requested cut without any professional input or warning, despite knowing it is unsuitable. This could lead to client dissatisfaction, damage the barber's reputation, and potentially be seen as a failure to provide competent service, as the barber did not use their expertise to guide the client towards a better outcome. This breaches the duty to act in the client's best interest. A third incorrect approach is to condescendingly dismiss the client's idea and insist on a different style without acknowledging the client's preferences. While the barber's intention might be good, the execution lacks respect for the client's input and can create an adversarial relationship, undermining the trust essential for a professional service. This fails to adhere to the principles of client consultation and collaborative decision-making. Professional reasoning. Professionals should approach such situations by first actively listening to the client's request and understanding their desired outcome. Following this, a thorough consultation should occur where the barber assesses the client's hair type, texture, density, and face shape. The barber should then clearly and respectfully communicate their professional opinion, explaining the rationale behind their assessment and any potential challenges with the requested style. Crucially, the barber should offer well-reasoned alternative suggestions that still aim to meet the client's underlying aesthetic goals. This collaborative process ensures the client feels heard and valued, while the barber utilizes their expertise to guide the service towards a successful and satisfying result. Question 4. Operational review demonstrates that a long-standing client who is aware you also service their estranged spouse asks you to reveal whether the spouse has been attending appointments, citing concerns about their well-being. What is the most ethically sound and professionally appropriate course of action? Option A. Suggest the client speak directly to their estranged spouse about their well-being concerns, while offering no information yourself. Option B. Inform the client that their spouse has indeed been attending appointments, as you believe their concern for well-being warrants this information. Option C. Politely decline the request, explaining that client confidentiality prevents you from discussing any client's appointment history or personal details, without confirming or denying the spouse's attendance. Option D. Discreetly confirm the spouse's attendance to the client, assuring them that this information will be kept strictly between the two of you. The correct answer is C. Politely decline the request, explaining that client confidentiality prevents you from discussing any client's appointment history or personal details, without confirming or denying the spouse's attendance. Explanation. This scenario presents a professional challenge rooted in the conflict between a client's personal request and the barber's ethical and legal responsibilities. The core of the dilemma lies in maintaining client confidentiality, while also adhering to professional standards and potentially legal obligations. A barber must exercise careful judgment to navigate this situation without compromising trust or violating regulations. The correct approach prioritizes client confidentiality and professional boundaries. It involves respectfully declining the request while explaining the ethical and professional reasons behind the refusal, without divulging any information about the other client. This upholds the barber's commitment to privacy, which is a cornerstone of professional conduct and often implicitly or explicitly covered by professional guidelines and potentially data protection laws, depending on the specific jurisdiction's interpretation of client information. It demonstrates integrity and a commitment to ethical practice, ensuring that all clients feel secure in the privacy of their interactions. An incorrect approach that involves sharing the requested information would be a severe breach of client confidentiality. This violates the trust placed in the barber and could have serious repercussions, including damage to reputation and potential legal action. It directly contravenes the ethical duty to protect client information. Another incorrect approach, such as fabricating information or misleading the client, undermines professional integrity and honesty. While it might seem like a way to avoid direct refusal, it is ethically unsound and erodes the foundation of trust essential in a professional relationship. Finally, an approach that involves confronting the other client about the request would also be inappropriate, as it breaches the confidentiality of the first client and creates an uncomfortable and unprofessional situation for all parties involved. Professionals should approach such situations by first recognizing the ethical conflict. They should then consider their professional code of conduct and any relevant legal obligations regarding client privacy. The decision-making process should involve a commitment to honesty, respect for client confidentiality, and maintaining professional boundaries. If unsure, seeking guidance from a professional body or supervisor is advisable. Question 5. The efficiency study reveals that implementing a new client scheduling system could increase the number of services performed daily by 15%. However, the proposed workflow suggests a reduction in the time allocated for tool disinfection between clients, from 10 minutes to 3 minutes, with the rationale that tools are only visibly soiled occasionally. A barber is considering adopting this new system to boost their income. Option A. The barber should prioritize complete disinfection of all tools between each client, even if it means adjusting the schedule or informing clients of potential minor delays, as this adheres to OSHA guidelines for preventing disease transmission. Option B. The barber should only disinfect tools at the end of the day, as this is more efficient and the risk of transmission is low if clients are not visibly ill. Option C. The barber should wipe tools with a towel between clients to maintain a semblance of cleanliness while adhering to the faster disinfection schedule. Option D. The barber should adopt the new system and reduce disinfection time to 3 minutes, as the study indicates increased efficiency and tools are not always visibly soiled, suggesting less frequent deep cleaning is acceptable. The correct answer is A. The barber should prioritize complete disinfection of all tools between each client, even if it means adjusting the schedule or informing clients of potential minor delays, as this adheres to OSHA guidelines for preventing disease transmission. Explanation. Scenario analysis. This scenario presents a common challenge in barbering, balancing client flow and service speed with the non-negotiable requirement of maintaining a sanitary environment. The pressure to serve more clients can lead to shortcuts in sanitation, which directly impacts client safety and the barber's professional integrity. The core challenge is recognizing that sanitation is not a variable that can be adjusted for efficiency. It is a fundamental aspect of safe practice. Correct approach analysis. The correct approach prioritizes the complete disinfection of tools between each client. This aligns directly with OSHA guidelines for preventing the spread of infectious diseases in the workplace. Specifically, OSHA Bloodborne Pathogen Standard 29 CFR 1910, 1030, mandates that all reusable tools that come into contact with blood or bodily fluids must be properly cleaned and disinfected or sterilized before reuse. This meticulous process ensures that no pathogens are transferred from one client to another, safeguarding public health and adhering to legal and ethical obligations. It demonstrates a commitment to client well-being and professional responsibility, which are paramount in the barbering profession. Incorrect approaches analysis. One incorrect approach involves wiping tools with a towel between clients. This is a critical failure because a towel, even if damp, does not effectively kill microorganisms or remove all visible debris. It merely redistributes them, failing to meet the disinfection standards required by OSHA. This practice poses a significant risk of cross-contamination and disease transmission. Another incorrect approach is to only disinfect tools at the end of the day. This is a severe violation of sanitation protocols. Disinfection must occur between each client service to prevent the transmission of pathogens. Delaying disinfection until the end of the day means that all clients served throughout the day were potentially exposed to contaminated tools, creating a widespread risk of infection. A third incorrect approach is to assume that visible cleanliness equates to sterility or disinfection. While tools should be visibly clean, this does not guarantee the absence of microscopic pathogens. Disinfection and sterilization are chemical or physical processes that actively kill or inactivate microorganisms. Relying solely on visual inspection is insufficient and dangerous, as many harmful pathogens are not visible to the naked eye. This approach neglects the fundamental principles of infection control. Professional reasoning. Professionals in barbering must adopt a decision-making process that places client safety and regulatory compliance above all else. When faced with time pressures, the professional should first assess if the required sanitation steps can be completed safely and effectively within the allotted time. If not, the professional must either adjust the schedule, inform the client of a potential delay due to necessary sanitation, or decline to take on additional clients until proper sanitation can be performed. The guiding principle is always safety first, supported by a thorough understanding of and adherence to OSHA regulations and best practices in infection control. This proactive approach prevents ethical breaches and legal repercussions. Question 6. Benchmark analysis indicates that a client presents for a chemical hair straightening service, but upon visual inspection, the barber observes mild redness and a few small, dry flakes on the client's scalp. The client reports no itching or discomfort. What is the most appropriate initial course of action to ensure client safety and regulatory compliance? Option A. Advise the client to use an over-the-counter anti-dandruff shampoo for a week before returning for the service, without performing any immediate tests. Option B. Conduct a thorough consultation, including a detailed history of scalp conditions and previous chemical services, and perform a patch test for the straightening product to assess for potential sensitivity. Option C. Apply a generic soothing conditioner to the scalp before the chemical straightening solution to mitigate any potential irritation. Option D. Proceed with the chemical straightening service as planned, assuming the mild redness and flaking are insignificant and will not affect the outcome or client safety. Correct answer is B. Conduct a thorough consultation, including a detailed history of scalp conditions and previous chemical services, and perform a patch test for the straightening product to assess for potential sensitivity. Explanation. Scenario analysis. This scenario presents a common challenge in barbering where a client requests a chemical service, but their scalp exhibits signs of irritation. The professional must balance the client's desire for a service with the paramount responsibility of client safety and the integrity of their hair and scalp. This requires a nuanced understanding of chemical reactions, product ingredients, and the potential for adverse reactions, all within the context of regulatory requirements for safe practice. The challenge lies in accurately assessing the risk and making an informed decision that prioritizes health and safety without unnecessarily alienating the client. Correct approach analysis. The correct approach involves a thorough consultation, including a visual inspection of the scalp and a patch test. This aligns with the fundamental principles of chemical safety and client care mandated by regulatory frameworks for barbering. Regulatory guidelines emphasize the importance of client assessment prior to chemical services to prevent adverse reactions, such as burns, allergic responses, or further scalp damage. A patch test, specifically, is a regulatory requirement in many jurisdictions to identify potential sensitivities to chemical ingredients, thereby mitigating the risk of severe reactions. This proactive approach demonstrates adherence to professional standards and ethical obligations to provide services safely. Incorrect approach is analysis. Proceeding with the chemical service without a proper consultation and patch test is a significant regulatory and ethical failure. It directly violates the principle of client safety by disregarding visible signs of scalp irritation, which could indicate a pre-existing condition or sensitivity. This oversight can lead to severe adverse reactions, potentially resulting in legal liability for the barber and disciplinary action from regulatory bodies. Suggesting a generic soothing product without understanding the underlying cause of the irritation or its interaction with the intended chemical service is also problematic. This approach lacks a scientific basis and fails to address the root issue, potentially masking a more serious problem or exacerbating the irritation. It bypasses the necessary diagnostic steps and relies on guesswork, which is contrary to the evidence-based practices expected in professional barbering. Recommending the client simply wash their hair more often, as a solution to scalp irritation before a chemical service, is dismissive and unprofessional. It fails to acknowledge the potential chemical or biological reasons for the irritation and does not address the safety concerns related to performing a chemical service on compromised skin. This approach neglects the barber's responsibility to assess and manage risks associated with chemical treatments. Professional reasoning. Professionals should adopt a systematic approach when faced with potential contraindications for chemical services. This involves 1. Active listening and consultation. eliciting information about the client's hair and scalp history, current concerns, and desired outcome. 2. Visual assessment, carefully inspecting the scalp for any signs of redness, flaking, abrasions, or other abnormalities. 3. Risk assessment, evaluating the potential risks of proceeding with the service based on the consultation and assessment. 4. Informed decision-making, if risks are identified, clearly communicating these to the client and explaining the rationale for any recommended modifications or deferrals of the service. 5. Adherence to safety protocols, always performing patch tests as required by regulations and product instructions, especially for new clients or when using new products. 6. Documentation, maintaining records of consultations, assessments, and decisions made. This structured process ensures that client safety is prioritized, regulatory compliance is maintained, and professional judgment is exercised effectively. Question 7. The audit findings indicate that a barber, during a pre-service skin analysis for a facial treatment, observed significant areas of active, inflamed acne on the client's face. The barber is aware that active acne can be a contraindication for certain facial techniques and products. Considering the regulatory framework for barbering examinations, which of the following actions best represents professional best practice in this situation? Option A. Form a modified facial service, focusing only on cleansing and moisturizing without exfoliation or massage. Option B. Refuse to perform the facial service and recommend the client consult a dermatologist for their skin condition. Option C. Proceed with the standard facial service, using gentle products and techniques to minimize irritation. Option D. Proceed with the full facial service as planned, assuming the client is aware of the risks. The correct answer is C. Proceed with the standard facial service, using gentle products and techniques to minimize irritation. Explanation. Scenario analysis. This scenario presents a common challenge in barbering where a client's skin condition may contraindicate a standard service. The professional must balance client satisfaction with the ethical and regulatory obligation to provide safe services. Misjudging the severity or nature of a skin condition can lead to adverse reactions, client harm, and potential legal or regulatory repercussions. The challenge lies in accurately assessing the skin, understanding contraindications, and communicating effectively with the client to offer appropriate alternatives. Correct approach analysis. The correct approach demonstrates a commitment to client safety and adherence to professional standards. A thorough skin analysis is paramount before any facial service. Identifying a potential contraindication like active acne requires the barber to exercise professional judgment and consult their knowledge of skin disorders and conditions as outlined in barbering regulations. Refusing the service and recommending a dermatologist is the safest and most responsible course of action. This aligns with the ethical duty to do no harm and the regulatory requirement to provide services within one's scope of practice and to recognize when a client requires specialized medical attention. This approach prioritizes the client's well-being over immediate service revenue. Incorrect approaches analysis. One incorrect approach involves proceeding with the facial service despite visible signs of active acne. This is a direct violation of the principle of client safety and potentially breaches regulations regarding the provision of services when contraindications exist. It could lead to exacerbating the acne, causing infection or other skin damage, resulting in client harm and potential disciplinary action from regulatory bodies. Another incorrect approach is to perform a less intensive facial service without proper assessment or modification. While seemingly a compromise, if the underlying condition, active acne, is not addressed or understood, even a gentle service could irritate the skin and worsen the condition. This demonstrates a lack of thorough skin analysis and a failure to recognize the specific needs and risks associated with the client's skin. A third incorrect approach is to ignore the visible skin condition and proceed with the service as if the acne were not present. This shows a disregard for professional responsibility and a failure to conduct a proper skin analysis, which is a fundamental requirement before any facial treatment. It prioritizes the service over the client's health and safety, leading to potential harm and regulatory noncompliance. Professional reasoning. Professionals should always begin with a comprehensive client consultation and a detailed skin analysis. This includes visually inspecting the skin for any abnormalities, lesions, or conditions. If a contraindication is identified, such as active inflammation or infection, the professional must consult their knowledge base regarding contraindications for specific services. The decision-making process should prioritize client safety above all else. If a service cannot be safely performed, the professional should clearly and politely explain the reason to the client, recommend appropriate medical consultation if necessary, and suggest alternative services that are safe and beneficial. Maintaining accurate client records, including observations made during the skin analysis, is also a crucial part of professional practice and regulatory compliance. Question 8. The monitoring system demonstrates a client presenting with significant, persistent redness, scaling, and itching on their scalp, which appears more severe than typical dandruff. The barber has observed these symptoms during the consultation. Option A. Suggest a natural oil treatment that is known to soothe irritated skin. Option B. Recommend a specific medicated shampoo available over the counter for severe dandruff. Option C. Advise the client that the condition requires a dermatologist's evaluation and provide a referral. Option D. Proceed with the scheduled haircut, focusing only on the hair and ignoring the scalp condition. The correct answer is C. Advise the client that the condition requires a dermatologist's evaluation and provide a referral. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a barber to identify a potentially serious scalp condition that falls outside their scope of practice. Misidentification or attempting to treat a condition beyond their expertise can lead to client harm, delayed proper medical treatment, and potential legal or regulatory repercussions. The barber must balance providing good customer service with their professional responsibility to recognize limitations and refer appropriately. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and adheres to the established scope of practice for a barber. Recognizing the signs of a condition that requires medical attention and referring the client to a qualified healthcare professional, such as a dermatologist, is ethically sound and legally compliant. This action prevents potential harm from incorrect self-treatment or delayed diagnosis by a medical expert. It upholds the barber's professional integrity by acknowledging their limitations and acting responsibly. Incorrect approaches analysis. Attempting to diagnose and recommend over-the-counter treatments for a suspected fungal infection is an ethical and regulatory failure. Barbers are not licensed to diagnose medical conditions or prescribe treatments. This action could lead to the client using ineffective or inappropriate products, worsening the condition, and delaying essential medical intervention. It also exposes the barber to liability for practicing medicine without a license. Suggesting a home remedy or a specific shampoo without a proper diagnosis is also a failure. While seemingly helpful, it bypasses the necessary medical evaluation. The condition could be something more serious than simple dandruff, and a home remedy might mask symptoms or exacerbate the underlying issue. This constitutes practicing outside the scope of barbering and could lead to client harm. Ignoring the client's concerns and proceeding with a standard haircut without any acknowledgement of the visible scalp issue is a failure in professional duty of care and client communication. While not directly causing harm through treatment, it demonstrates a lack of attentiveness to the client's well-being and a missed opportunity for responsible referral. This can erode client trust and potentially lead to the client seeking advice from less qualified sources. Professional reasoning. Professionals should employ a decision-making process that begins with careful observation of the client's condition. They must then assess whether the observed issue falls within their defined scope of practice and expertise. If the condition appears to be a medical issue requiring diagnosis or treatment beyond basic hygiene or cosmetic services, the professional's responsibility is to clearly and respectfully inform the client of their observations and recommend seeking professional medical advice from an appropriate healthcare provider. Documentation of the observation and the referral recommendation is also a crucial step in professional practice. Question 9. The assessment process reveals that a client who has previously undergone a keratin smoothing treatment is now requesting a permanent wave service. The client states they have not had any other chemical treatments in the last 6 months. What is the most responsible and regulatory compliant approach to proceed? Option A. Refuse the service immediately without further assessment, citing the previous keratin treatment as a definitive contraindication. Option B. Apply a stronger perm solution to ensure the wave takes effectively, given the history of a smoothing treatment. Option C. Proceed with the permanent wave using a standard perm solution, assuming the keratin treatment has fully washed out. Option D. Perform a strand test to evaluate the hair's reaction to the perm solution and processing time before proceeding with the full service. Correct answer is D. Perform a strand test to evaluate the hair's reaction to the perm solution and processing time before proceeding with the full service. Explanation. Scenario analysis. This scenario presents a common challenge in barbering where a client requests a chemical service that may be contraindicated due to previous treatments. The professional must balance client satisfaction with the ethical and regulatory obligation to provide safe services. The challenge lies in accurately assessing the hair's condition, understanding the potential interactions of chemicals, and communicating effectively with the client about risks and alternatives. Failure to do so can lead to severe hair damage, client dissatisfaction, and potential liability. Correct approach analysis. The correct approach prioritizes client safety and hair health by conducting a thorough consultation and strand test. This aligns with regulatory requirements for safe practice, which mandate that barbers assess client suitability for chemical services and take all reasonable precautions to prevent harm. A strand test specifically evaluates how the hair will react to the perm solution and processing time, providing empirical data to inform the decision. This proactive measure is the cornerstone of responsible chemical service application, preventing damage and ensuring adherence to professional standards. Incorrect approaches analysis. One incorrect approach involves proceeding with the perm without a strand test, relying solely on the client's verbal history. This is a regulatory failure as it bypasses a critical safety protocol designed to prevent chemical damage. Ethically, it demonstrates a lack of due diligence and prioritizes expediency over client well-being. Another incorrect approach is to refuse the service outright without a proper assessment. While caution is important, a complete refusal without attempting to gather more information or explore alternatives might be seen as poor customer service and a missed opportunity to educate the client. However, if the assessment clearly indicates extreme risk, refusal becomes the only safe and ethical option. The failure here would be in the lack of a thorough assessment before refusal. A third incorrect approach is to use a stronger perm solution than typically recommended, assuming it will overcome any previous chemical treatments. This is a direct violation of chemical safety guidelines and demonstrates a fundamental misunderstanding of chemical interactions and hair structure. It significantly increases the risk of breakage, scalp irritation, and irreversible damage, constituting a severe ethical and regulatory breach. Professional reasoning. Professionals should always begin chemical services with a comprehensive consultation, including a detailed history of previous treatments. This should be followed by a physical assessment of the hair's condition. A strand test is a non-negotiable step when there is any doubt about the hair's integrity or its reaction to the proposed chemical. If the strand test indicates potential damage, the professional must clearly communicate the risks to the client and offer safer alternatives, such as a different type of styling service or a conditioning treatment. The decision-making process is guided by the principle of do no harm, supported by regulatory mandates for safe practice. Question 10. Risk assessment procedures indicate that a client requests a drastic change in hairstyle that may not be achievable or suitable for their current hair condition and texture. Which of the following consultation steps is most crucial for ensuring client satisfaction and professional integrity? Option A. Thoroughly assess the client's hair type, condition, and lifestyle, discuss the feasibility of their desired outcome, and propose alternative solutions that align with their hair's capabilities and their aesthetic goals. Option B. Proceed with the requested hairstyle, assuming the client understands the potential risks and outcomes. Option C. Politely refuse the client's request without offering any explanation or alternatives. Option D. Immediately agree to the client's requested hairstyle to ensure they feel heard and accommodated. The correct answer is A. Thoroughly assess the client's hair type, condition, and lifestyle, discuss the feasibility of their desired outcome, and propose alternative solutions that align with their hair's capabilities and their aesthetic goals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the barber to balance a client's stated desire with their own professional expertise and the practical limitations of hair. Misinterpreting the client's expectations or failing to communicate potential outcomes can lead to dissatisfaction, damage to the barber's reputation, and potentially violate professional standards of care. The barber must navigate the client's perception versus reality while ensuring the service delivered is safe, effective, and aligns with industry best practices. Correct approach analysis. The correct approach prioritizes a comprehensive understanding of the client's needs and expectations through open-ended questioning and active listening. It involves assessing the client's hair type, condition, and lifestyle to determine the feasibility of their desired outcome, recommending appropriate services based on this assessment, and clearly communicating potential results, limitations, and aftercare advice forms the foundation of best professional practice. This aligns with regulatory frameworks that emphasize client safety, informed consent, and professional competence. Ethically, it demonstrates respect for the client and a commitment to delivering a satisfactory and safe service. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the client's request without further inquiry. This fails to assess the client's true needs or the feasibility of the request, potentially leading to an unsatisfactory outcome and a breach of professional duty of care. It neglects the barber's responsibility to provide expert advice and manage client expectations, which could be seen as unprofessional conduct. Another incorrect approach is to dismiss the client's request outright without explanation or offering alternatives. This demonstrates poor communication skills and a lack of empathy, potentially alienating the client and damaging the business's reputation. It fails to explore the underlying reasons for the client's request or to offer solutions that might meet their underlying desires within realistic parameters. A third incorrect approach is to proceed with a service that is clearly not suitable for the client's hair type or condition, based solely on the client's insistence. This is a direct violation of professional responsibility and could lead to hair damage, client dissatisfaction, and potential liability. It prioritizes client appeasement over professional judgment and client well-being, which is ethically and regulatorily unacceptable. Professional reasoning. Professionals should adopt a systematic approach to client consultation. This involves creating a welcoming environment, asking open-ended questions about their desired look, lifestyle, and hair history. Active listening and paraphrasing are crucial to confirm understanding. A visual assessment of the hair's condition, texture, and growth patterns is essential. Based on this, the barber should then offer expert recommendations, explaining the rationale behind them and discussing potential outcomes, including any limitations or risks. Transparency about pricing and aftercare is also vital. This process ensures informed consent and builds trust, leading to better client satisfaction and adherence to professional standards. Question 11. The risk matrix shows a moderate risk of skin irritation and potential infection when performing a straight razor shave on a client with a history of eczema. The client has requested a close shave of their beard. What is the most appropriate course of action for the barber to ensure client safety and adhere to professional standards? Option A. Use a duller, less sharp razor to reduce the risk of nicks, and apply a generous amount of aftershave to combat any irritation. Option B. Decline to perform the straight razor shave and suggest a beard trim with clippers instead, without further explanation. Option C. Proceed with the shave as requested, using a standard shaving cream and technique, assuming the client is aware of their skin's condition. Option D. Perform a thorough skin analysis, discuss the risks with the client, and if proceeding, use a sharp, sanitized straight razor with a light touch, focusing on areas with less inflammation, and recommend a soothing aftershave. The correct answer is D. Perform a thorough skin analysis, discuss the risks with the client, and if proceeding, use a sharp, sanitized straight razor with a light touch, focusing on areas with less inflammation, and recommend a soothing aftershave. Explanation. This scenario presents a professional challenge due to the inherent risks associated with shaving services, particularly when dealing with a client who has a pre-existing skin condition. The barber must balance providing a desired service with ensuring client safety and adhering to sanitation regulations. Careful judgment is required to assess the client's skin, select appropriate tools and techniques, and manage potential complications. The correct approach represents best professional practice because it prioritizes client health and safety above all else, aligning with the core principles of responsible barbering. This involves a thorough skin analysis to identify contraindications, the use of sanitized equipment, and the application of appropriate shaving techniques that minimize irritation. Adherence to sanitation and sterilization protocols is a direct regulatory requirement to prevent the spread of infection and disease, ensuring a safe environment for both the client and the barber. Ethical practice dictates that a barber should not proceed with a service if it poses an undue risk to the client's well-being, An incorrect approach that involves proceeding with a standard shave without considering the client's eczema would be a significant regulatory and ethical failure. This demonstrates a lack of due diligence in performing a proper skin analysis, which is a fundamental step in safe barbering practice. It also violates the ethical obligation to avoid causing harm. Another incorrect approach, such as using non-sanitized tools, would be a direct violation of sanitation and sterilization regulations, posing a severe risk of infection transmission. Furthermore, attempting to shave over inflamed or broken skin without proper precautions could lead to further injury and exacerbate the client's condition, constituting a breach of professional duty of care. The professional decision-making process for similar situations should involve a systematic evaluation. First, conduct a comprehensive client consultation and skin analysis, looking for any signs of irritation, inflammation, or contraindications. Second, assess the risks versus benefits of proceeding with the service. If the risks are high, it is imperative to decline or modify the service. Third, if proceeding, ensure all tools and equipment are properly sanitized and sterilized according to regulatory standards. Fourth, employ appropriate shaving techniques that are gentle and minimize trauma to the skin, especially when dealing with sensitive or compromised skin. Finally, always communicate clearly with the client about the process, any concerns, and post-shave care recommendations. Question 12. Quality control measures reveal a client with fine, straight hair is requesting a voluminous, intricate updo for a formal event. The barber has assessed the hair's texture and density. Which of the following approaches best demonstrates professional competence and client-centered service in this situation? Option A. Proceed with the client's requested intricate updo using standard techniques, hoping the volume will hold throughout the event, and apply a light hold hairspray to avoid stiffness. Option B. Attempt to create the requested voluminous updo by using excessive heat styling and strong hold gels, even though this may compromise the hair's integrity and make it appear greasy. Option C. Recommend a modified updo that utilizes volumizing mousse, strategic backcombing, and a strong hold hairspray to create the illusion of fullness and ensure longevity, while explaining the limitations of achieving extreme volume on fine hair. Option D. Advise the client that a voluminous updo is impossible on fine, straight hair, and suggest a simple ponytail instead, without offering any alternative styling solutions. Correct answer is C. Recommend a modified updo that utilizes volumizing mousse, strategic backcombing, and a strong hold hairspray to create the illusion of fullness and ensure longevity, while explaining the limitations of achieving extreme volume on fine hair. Explanation. This scenario presents a professional challenge because a barber must balance client satisfaction with the practical limitations of hair type and texture, while also adhering to established styling techniques and product knowledge. The client's desire for a specific, high-volume updo on fine, straight hair requires careful consideration of how to achieve the desired effect without compromising the hair's integrity or the longevity of the style. The barber's decision-making process must integrate an understanding of how different styling tools and products interact with various hair types. The correct approach represents best professional practice because it prioritizes a realistic and achievable outcome based on the client's hair characteristics. It involves selecting appropriate techniques and products that can add volume and hold to fine hair, such as backcombing, using volumizing mousse, and securing the style with strong hold hairspray. This approach demonstrates a thorough understanding of product knowledge and styling techniques, ensuring client safety and satisfaction within the bounds of what is technically feasible for their hair type. It aligns with the ethical obligation to provide competent and honest service. An incorrect approach that involves attempting the client's requested style without modification, using excessive heat or aggressive manipulation on fine hair, could lead to heat damage, breakage, and a style that quickly falls flat, resulting in client dissatisfaction and potential damage to their hair. This would be a failure in professional judgment and potentially a breach of the duty of care. Another incorrect approach might be to dismiss the client's request outright without offering viable alternatives, which could be perceived as poor customer service and a lack of willingness to problem solve. Ethically, barbers are expected to be accommodating and resourceful. A third incorrect approach could be to use inappropriate products, such as heavy waxes or pomades on fine hair, which would weigh it down and prevent the desired volume, leading to an unsuccessful style and wasted client time and money. This demonstrates a lack of product knowledge. Professionals should approach such situations by first actively listening to the client's desires and then assessing the client's hair type and texture. They should then explain the possibilities and limitations, offering alternative styling solutions that can achieve a similar aesthetic while being suitable for the client's hair. This involves transparent communication, demonstrating expertise in hair styling techniques and product application, and collaboratively arriving at a plan that ensures a positive and successful outcome. Question 13. Process analysis reveals that a barber is preparing to serve a new client immediately after finishing with a previous one. The barber notices that their clippers have some hair clippings on them from the previous client, and that the disinfection solution for their combs has been depleted. The barber is concerned about delaying the next service due to the need to clean and disinfect tools and the lack of fresh disinfectant. Which of the following actions best adheres to state and federal barbering laws and regulations? Option A. Proceed with the service using the clippers as they are, and inform the client that the comb disinfectant is out, suggesting they wait until it can be replenished. Option B. Use a different set of clippers that appear cleaner, and use a different comb without disinfecting it, assuming the risk is minimal for a short service. Option C. Inform the client about the delay due to the need to properly clean and disinfect tools according to safety regulations, and offer to reschedule or provide an alternative service that does not require the affected tools until the disinfectant can be replenished. Option D. Briefly wipe the clippers with a dry cloth to remove visible hair and proceed with the service, explaining to the client that the disinfectant is temporarily unavailable, but that the clippers are otherwise clean. Correct answer is A. Proceed with the service using the clippers as they are, and inform the client that the comb disinfectant is out, suggesting they wait until it can be replenished. Explanation. Scenario analysis. This scenario presents a common challenge for barbers, balancing the need to provide services efficiently with the absolute requirement of maintaining a sanitary environment as mandated by state and federal regulations. The professional challenge lies in recognizing that a perceived time constraint or customer demand does not supersede public health and safety laws. Failure to adhere to sanitation protocols can lead to the spread of infectious diseases, posing a significant risk to clients and the barber. This requires a barber to exercise sound judgment, prioritize safety over expediency, and understand the legal ramifications of noncompliance. Correct approach analysis. The correct approach demonstrates a thorough understanding and commitment to the sanitation and safety regulations governing barbering. It prioritizes the client's well-being and the integrity of the establishment by strictly adhering to established protocols for cleaning and disinfecting tools and equipment between clients. This aligns directly with state board regulations and federal guidelines, such as those from OSHA and the CDC, which inform state regulations that mandate specific disinfection procedures to prevent the transmission of pathogens. This practice is not merely a recommendation but a legal obligation, ensuring the barber operates within the bounds of the law and upholds professional ethical standards of care. Incorrect approaches analysis. One incorrect approach involves a superficial cleaning of tools, such as wiping them down with a cloth without proper disinfection. This fails to meet the minimum standards for killing microorganisms and directly violates sanitation regulations, creating a significant health hazard. Another incorrect approach is to reuse disposable items like razors or guards without replacing them. This is a severe breach of sanitation protocols, as these items are designed for single use and can harbor bacteria and viruses, leading to infections and violating licensing requirements that ensure safe practice. A third incorrect approach is to ignore visible debris on tools and proceed with service, assuming it is not a significant issue. This demonstrates a disregard for basic hygiene and a failure to recognize that any visible contamination necessitates immediate and proper cleaning and disinfection, as required by law. Professional reasoning. Professionals in barbering must adopt a decision-making process that begins with a clear understanding of all applicable state and federal laws and regulations concerning licensing, sanitation, and safety. When faced with a situation where a client's request or a perceived time pressure might tempt a deviation from these standards, the barber must first consult their knowledge of these regulations. The core principle should always be safety first. This involves a mental checklist. Are my tools clean and disinfected according to protocol? Are disposable items being used appropriately? Is the work area sanitary? If any doubt exists, the correct action is to pause, rectify the situation according to regulations, and communicate with the client if necessary, explaining the importance of these safety measures. This proactive approach prevents regulatory violations, protects public health, and maintains the barber's professional reputation and license. Question 14. Compliance review shows that a barber, in a busy salon, has been reusing disposable razors for multiple clients due to a perceived shortage and a desire to avoid client wait times. The barber believes that a quick wipe with an antiseptic solution is sufficient to prevent cross-contamination. What is the most appropriate course of action for the salon owner to take in response to this compliance review finding? Option A. Immediately retrain all staff on proper sanitation protocols, dispose of all previously used disposable razors, and implement a strict inventory management system for single-use items. Option B. Counsel the barber involved, reminding them of the importance of following sanitation guidelines and monitor their practices closely moving forward. Option C. Acknowledge the barber's initiative to manage inventory, but reiterate the importance of adhering to sanitation regulations, and suggest exploring bulk purchasing options for disposable razors. Option D. Issue a verbal warning to the barber and instruct them to ensure all disposable razors are properly disposed of after each use, assuming this was an isolated incident. The correct answer is A. Immediately retrain all staff on proper sanitation protocols, dispose of all previously used disposable razors, and implement a strict inventory management system for single-use items. Explanation: this scenario presents a professional challenge because it requires a barber to balance client satisfaction with strict adherence to state board regulations regarding sanitation and safety. The barber must recognize that even a seemingly minor deviation from established protocols can have significant consequences, including potential health risks to clients and disciplinary action against the barber and the establishment. Careful judgment is required to prioritize public health and safety above all else. The correct approach represents best professional practice because it directly addresses the identified violation by immediately implementing corrective measures and ensuring future compliance. This demonstrates a commitment to upholding the standards set by the state board, protecting clients, and maintaining the integrity of the profession. It also aligns with the ethical obligation to operate a safe and sanitary establishment. An incorrect approach that involves ignoring the issue or downplaying its significance fails to acknowledge the seriousness of sanitation regulations. This constitutes a direct violation of state board laws and regulations governing barbering practices, which mandate strict adherence to sanitation protocols to prevent the spread of infections. Another incorrect approach that involves making a superficial fix without understanding the root cause or implementing lasting changes also falls short. This demonstrates a lack of commitment to true compliance and a disregard for the underlying principles of safety and hygiene. Such actions can lead to recurring violations and a compromised client experience. Professionals should approach such situations by first understanding the specific regulation that has been violated. Then, they should assess the immediate risk to clients and take prompt action to mitigate that risk. This is followed by a thorough investigation into why the violation occurred and the development of a plan to prevent recurrence. This plan should include retraining staff, updating procedures, and implementing regular checks. This systematic approach ensures that compliance is not just a one-time fix, but an ongoing commitment to professional standards. Question 15. The evaluation methodology shows that a client who has recently been diagnosed with a mild, non-contagious scalp condition that is currently asymptomatic requests a deep scalp massage using a product not typically stocked by the salon, which they brought from home. The client insists the product is safe and effective for their condition. What is the most professional and regulatory compliant course of action for the barber? Option A. Agree to use the client's personal product for the scalp massage, as the client states it is safe and their condition is mild and asymptomatic, to ensure client satisfaction. Option B. Inform the client that due to their scalp condition, scalp massages are not recommended at this time and suggest they consult their doctor before proceeding with any salon services. Option C. Perform the scalp massage using the client's personal product, but ensure to thoroughly sanitize all tools afterward to mitigate any potential risks. Option D. Politely decline the use of the client's personal product, explaining that salon policy and health regulations require the use of only approved and sanitized salon products to prevent cross-contamination and ensure client safety, and offer to perform the scalp massage with an appropriate salon-approved product. The correct answer is D. Politely decline the use of the client's personal product, explaining that salon policy and health regulations require the use of only approved and sanitized salon products to prevent cross-contamination and ensure client safety, and offer to perform the scalp massage with an appropriate salon-approved product. Explanation: this scenario presents an ethical dilemma common in client-facing professions, where a barber must balance client satisfaction with professional responsibility and adherence to health and safety regulations. The challenge lies in a client's request that, while seemingly harmless to the client, could potentially violate established hygiene standards or expose the barber to unnecessary risk if not handled appropriately. The barber must exercise sound judgment, prioritizing the well-being of both the client and themselves, while also considering the professional reputation of the establishment and the broader implications for public health. The correct approach involves a professional and empathetic refusal of the client's request, coupled with an explanation of the underlying reasons rooted in health and safety regulations. This demonstrates best professional practice by upholding the barbering written examination's regulatory framework, which implicitly or explicitly mandates hygiene standards to prevent the spread of infections and maintain a safe working environment. By explaining the rationale, the barber educates the client and maintains a professional relationship, even when declining a service. This aligns with ethical principles of honesty, integrity, and duty of care. An incorrect approach would be to comply with the client's request without question. This failure represents a direct violation of health and safety regulations, potentially leading to cross-contamination, the spread of scalp conditions, and legal repercussions for the barber and the establishment. It also demonstrates a lack of professional judgment and a disregard for the well-being of other clients. Another incorrect approach would be to dismiss the client rudely or without explanation. This is unprofessional, damages the client relationship, and fails to educate the client on important health and safety considerations, potentially leading to future misunderstandings or non-compliance. Finally, attempting to perform the requested service in a compromised manner without proper sanitation would also be a significant ethical and regulatory failure, as it prioritizes expediency over safety. The professional decision-making process in such situations should involve 1. Actively listening to the client's request and understanding their perspective. 2. Assessing the request against established health, safety, and hygiene regulations relevant to barbering. 3. If the request poses a risk or violates regulations, politely and professionally decline. 4. Clearly and concisely explain the reasons for refusal, referencing health and safety protocols without being accusatory. 5. Offer alternative, safe, and compliant services that meet the client's underlying needs. 6. Document the interaction if it involves a significant deviation from standard practice or a potential risk. Question 16. Assessment of a barber's approach to recommending hair care products to a client experiencing dryness and mild scalp irritation, considering the client's stated budget and lifestyle. Which of the following approaches best exemplifies professional integrity and client-centered service? Option A. The barber engages in a detailed conversation about the client's hair washing frequency, water quality at home, and any styling products used, forms a gentle scalp examination, and then suggests a sulfate-free shampoo with soothing botanical ingredients and a lightweight conditioner, explaining how each addresses both dryness and irritation within the client's budget. Option B. The barber conducts a brief visual inspection, asks about the client's budget, and then recommends a premium moisturizing shampoo and conditioner set, highlighting their luxurious feel and long-lasting scent, without specifically addressing the scalp irritation. Option C. The barber immediately suggests a popular, widely advertised anti-dandruff shampoo, assuming the irritation is dandruff, and mentions it's on sale this week, without inquiring about the client's specific symptoms or budget. Option D. The barber recommends a generic, budget-friendly brand of shampoo and conditioner, stating that any moisturizing product will do for dryness, and dismisses the scalp irritation as a minor issue that will resolve on its own. The correct answer is B. The barber conducts a brief visual inspection, asks about the client's budget, and then recommends a premium moisturizing shampoo and conditioner set, highlighting their luxurious feel and long-lasting scent, without specifically addressing the scalp irritation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the barber to balance client satisfaction, product sales, and adherence to professional standards regarding product recommendations. The barber must understand the client's specific hair and scalp condition, their lifestyle, and their budget, while also possessing in-depth knowledge of the products available and their efficacy. Misjudging a client's needs or recommending an inappropriate product can lead to dissatisfaction, damage to the client's hair, and potential loss of business. Furthermore, the barber must navigate the ethical considerations of upselling versus genuinely meeting client needs. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the client's needs and hair health above immediate sales. This involves active listening to understand the client's concerns, conducting a thorough hair and scalp analysis, and then recommending products that directly address those identified needs. This approach aligns with ethical guidelines that emphasize client well-being and professional integrity. By explaining the benefits of the recommended products in relation to the client's specific issues, the barber builds trust and educates the client, fostering a long-term relationship. This also implicitly adheres to any regulatory requirements that might mandate providing accurate and beneficial advice to clients. Incorrect approaches analysis. Recommending the most expensive product without a clear justification based on the client's needs is an ethical failure. It prioritizes profit over client benefit and can be seen as deceptive or pushy salesmanship, potentially violating principles of honest practice. This approach fails to consider the client's budget and may lead to dissatisfaction if the product does not perform as expected or is not suitable for their hair type. Suggesting a product solely based on its popularity or a recent promotion, without considering its suitability for the client's specific hair and scalp condition, is a failure of professional judgment and potentially negligent. It overlooks the core responsibility of the barber to provide tailored advice. This could lead to adverse reactions or ineffective results, damaging the client's hair and the barber's reputation. Focusing only on products that offer the barber a higher commission, without regard for the client's actual requirements, is a clear ethical breach. This prioritizes personal gain over client welfare and professional duty, undermining the trust essential in the barber-client relationship. It also fails to meet the implicit expectation of providing expert advice based on product knowledge and client assessment. Professional reasoning. Professionals should employ a client-centered decision-making process. This begins with active listening and thorough assessment of the client's needs. Next, leverage comprehensive product knowledge to identify solutions that best meet those needs, considering efficacy, suitability, and client budget. Finally, communicate recommendations clearly, explaining the benefits and rationale, and allowing the client to make an informed decision. This process ensures ethical practice, client satisfaction, and sustainable business growth. Question 17. Comparative studies suggest that barbering professionals face common workplace hazards. In the event a client sustains a minor cut from a razor during a haircut, which of the following immediate actions best demonstrates adherence to safety protocols and professional responsibility? Option A. Continue the haircut, assuring the client that it is a minor nick and will heal on its own. Option B. Rinse the cut with water and advise the client to purchase an antiseptic wipe later. Option C. Immediately stop the service, apply direct pressure to the wound with a clean cloth or sterile gauze, and then proceed with appropriate wound cleaning and dressing. Option D. Immediately cease operations and call for emergency medical services for a minor razor cut. The correct answer is C. Immediately stop the service, apply direct pressure to the wound with a clean cloth or sterile gauze, and then proceed with appropriate wound cleaning and dressing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate and effective response to a common workplace injury in a barbering environment. The presence of sharp objects like razors and scissors inherently carries a risk of accidental cuts. A barber must not only possess the technical skill to perform services, but also the knowledge and preparedness to handle such incidents safely and efficiently, minimizing risk to both the client and themselves. This demands a calm demeanor, adherence to established protocols, and a thorough understanding of first aid principles. Correct approach analysis. The correct approach prioritizes immediate, safe, and effective intervention. This involves stopping the service, applying direct pressure to control bleeding, and then cleaning and dressing the wound appropriately. This aligns with best practices in first aid and infection control, which are fundamental to maintaining a safe and professional barbering environment. Regulatory frameworks for barbering typically mandate adherence to hygiene standards and the ability to manage minor injuries, ensuring client well-being and preventing potential complications like infection. This approach demonstrates a commitment to client safety and professional responsibility. Incorrect approaches analysis. One incorrect approach involves continuing the service despite the injury. This is a significant regulatory and ethical failure. It disregards the immediate need for first aid, potentially exacerbates the injury, and exposes the client to infection. It violates the fundamental duty of care owed to a client and contravenes hygiene regulations that require a sterile and safe environment. Another incorrect approach is to dismiss the injury as minor and offer no specific treatment beyond a quick rinse. This is also a regulatory and ethical lapse. While the cut may be minor, proper wound care is essential to prevent infection and promote healing. Failing to provide adequate first aid demonstrates a lack of professional responsibility and could lead to adverse outcomes for the client, potentially resulting in legal repercussions for the barber and establishment. A third incorrect approach is to panic and immediately call for emergency medical services for a minor cut. While it is important to know when to escalate, overreacting to a common, manageable injury can be inefficient and unnecessary. This approach fails to demonstrate the barber's competence in basic first aid, which is expected within the profession. It also diverts valuable emergency resources. Professional reasoning. Professionals should approach such situations by first assessing the severity of the injury. If it is a minor cut, the immediate steps are to stop the service, apply direct pressure with a clean cloth or sterile gauze, clean the wound with antiseptic, and apply a sterile dressing. If bleeding is severe or the cut is deep, then seeking professional medical attention is warranted. This decision-making process is guided by a hierarchy of safety, client well-being, and adherence to professional standards and regulations. It involves a rapid, yet considered, evaluation of the situation to determine the most appropriate course of action. Question 18. The performance metrics show a slight increase in client wait times due to the barber's adherence to sanitation protocols between clients. A client, who is in a hurry, expresses impatience and asks if the barber can proceed with the haircut using the clippers that were just used on the previous client, suggesting a quick wipe with a cloth is sufficient. Option A. Suggest the client return at a later time when there is less demand and sanitation protocols can be fully observed without causing delays. Option B. Inform the client that while sanitation is important, the risk is minimal in this specific instance and proceed with the haircut, promising to sanitize the clippers immediately after. Option C. Proceed with the haircut using the clippers, performing a quick wipe with a cloth as the client suggested, to avoid further delaying the service and potentially losing the client. Option D. Politely explain to the client that all tools, including clippers, must be properly disinfected or sterilized between each client to ensure their health and safety, and that this process is mandatory by regulation. Offer to expedite the sanitation process as much as possible or suggest an alternative service that can be performed immediately. The correct answer is D. Politely explain to the client that all tools, including clippers, must be properly disinfected or sterilized between each client to ensure their health and safety, and that this process is mandatory by regulation. Offer to expedite the sanitation process as much as possible or suggest an alternative service that can be performed immediately. Explanation. This scenario presents a professional challenge rooted in the ethical responsibility of a barber to maintain a safe and sanitary environment for clients, directly impacting public health and the reputation of the establishment. The core of the dilemma lies in balancing immediate client service with the non-negotiable requirement of proper equipment sanitation, as mandated by regulatory frameworks governing barbering practices. Careful judgment is required to uphold professional standards without compromising client trust or violating established health and safety protocols. The correct approach prioritizes client safety and regulatory compliance by ensuring all tools are properly sanitized before use. This aligns with the fundamental principles of infection control, which are paramount in any personal service industry. Specifically, regulations typically require that all reusable barbering tools that come into contact with a client's skin or hair, such as clippers, trimmers, scissors, and razors, must be thoroughly cleaned and disinfected or sterilized between each client. This prevents the transmission of bacteria, viruses, and fungi, safeguarding both the client and the barber. Adhering to these standards demonstrates a commitment to professional ethics and builds client confidence. An incorrect approach that involves using unsanitized clippers for a client presents a direct violation of health and safety regulations. This failure to disinfect or sterilize equipment between clients creates a significant risk of cross-contamination, potentially transmitting infections. Such negligence can lead to disciplinary action from regulatory bodies, including fines, suspension, or revocation of the barber's license. Ethically, it breaches the duty of care owed to the client. Another incorrect approach, which might involve a superficial wipe-down of clippers without proper disinfection, also fails to meet regulatory requirements. While seemingly an attempt to address sanitation, it does not eliminate pathogens effectively. Regulations typically specify the types of disinfectants and the required contact times for effective sanitization. A superficial clean is insufficient and poses a continued risk of infection transmission, leading to similar regulatory and ethical repercussions as using completely unsanitized tools. A third incorrect approach, such as claiming the clippers were recently sanitized when they were not, constitutes fraudulent misrepresentation. This not only violates health and safety regulations, but also erodes client trust and can lead to severe legal and professional consequences. It is a direct breach of ethical conduct and professional integrity. The professional decision-making process for similar situations should involve a clear understanding and consistent application of established sanitation protocols. Barbers must prioritize regulatory compliance and client well-being above all else. When faced with time constraints or pressure to serve clients quickly, it is crucial to remember that proper sanitation is a non-negotiable step. Professionals should always have adequate time allocated for cleaning and disinfecting tools, or have a system in place to manage workflow to ensure this is possible. If a tool is not properly sanitized, the barber must inform the client of the delay and explain the necessity of the sanitation process, reinforcing their commitment to safety. Question 19. To address the challenge of a client requesting a drastic and potentially unbalanced hair design change that conflicts with established principles of balance, proportion, and harmony, what is the most ethically sound and professionally responsible course of action for a barber? Option A. Explain how the requested change might disrupt the client's current balance and proportion, and propose a modified approach that incorporates their desire for change while maintaining aesthetic harmony and complementing their features. Option B. Politely but firmly refuse the client's request, stating that it is not a feasible or aesthetically pleasing option without further explanation. Option C. Immediately agree to the client's request to ensure their immediate satisfaction, regardless of potential design imbalances. Option D. Proceed with the drastic change as requested by the client, assuming their personal preference overrides professional design principles. The correct answer is A. Explain how the requested change might disrupt the client's current balance and proportion, and propose a modified approach that incorporates their desire for change while maintaining aesthetic harmony and complementing their features. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the barber to balance a client's personal preference with established principles of hair design and the practical limitations of the client's hair. The barber must navigate the client's desire for a dramatic change against the need to maintain balance and proportion in the overall look, considering the client's facial features and head shape. Ethical considerations arise from the barber's responsibility to provide a safe and aesthetically pleasing service, ensuring the client leaves satisfied and with a hairstyle that complements them, rather than detracting from their appearance. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a consultative process that educates the client on hair design principles. By explaining how a drastic change might disrupt the harmony and balance of their current look, and suggesting a more gradual, complementary approach, the barber upholds their ethical duty to provide expert advice. This aligns with the professional standard of ensuring client satisfaction through informed decision-making, respecting the elements of design, line, form, space, texture, color, to create a harmonious and balanced outcome. The barber acts as a trusted advisor, guiding the client towards a result that is both desirable and aesthetically sound. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the client's request without discussion. This fails to uphold the barber's professional responsibility to apply their expertise in hair design principles. It risks creating an unbalanced or disproportionate look, potentially leading to client dissatisfaction, and a breach of the implicit agreement to provide a skilled service. Ethically, it prioritizes immediate client appeasement over professional judgment and the client's long-term satisfaction with their appearance. Another incorrect approach is to dismiss the client's idea outright without explanation. This demonstrates poor communication and a lack of respect for the client's input. It can alienate the client and damage the professional relationship, failing to leverage the opportunity to educate them on design principles. Professionally, it misses the chance to collaboratively find a solution that meets the client's desires while adhering to design standards. A further incorrect approach is to proceed with the drastic change without considering the impact on the client's overall appearance and hair health. This disregards the principles of balance, proportion, and harmony, potentially resulting in a hairstyle that is unflattering or difficult to maintain. It represents a failure to apply professional knowledge and a disregard for the client's best interests. Professional reasoning. Professionals should approach such situations by initiating a thorough consultation. This involves actively listening to the client's desires, assessing their hair type and facial features, and then applying knowledge of hair design principles. The decision-making process should involve explaining the rationale behind design choices, offering alternative solutions that align with the client's goals and design principles, and collaboratively arriving at a plan. This ensures the client feels heard and understood, while the barber fulfills their professional obligation to deliver a high-quality, aesthetically pleasing, and well-balanced hairstyle. Question 20. Stakeholder feedback indicates that some clients request significant and immediate changes to their hairstyles, such as a dramatic length reduction or a complete style transformation, without fully understanding the implications for their hair type or face shape. A client enters the barber shop and requests to go from a long, layered style to a very short, blunt cut with a sharp fringe. What is the most professional and ethically sound approach for the barber to take? Option A. Agree to the drastic cut but express reservations about the outcome, leaving the client to bear the full responsibility if they are unhappy with the result. Option B. Suggest a slightly shorter, layered cut as a compromise, without fully explaining why the client's original request might not be ideal or offering to demonstrate the proposed change. Option C. Engage in a detailed consultation to discuss the client's vision, assess their hair type and face shape, explain the potential outcomes of a blunt cut and fringe, and propose a gradual approach or alternative styling options if the requested cut is deemed unsuitable or too drastic for an immediate change. Option D. Immediately proceed with the requested short, blunt cut and fringe, as the client has clearly stated their desire, and it is the barber's role to fulfill the client's request. The correct answer is C. Engage in a detailed consultation to discuss the client's vision, assess their hair type and face shape, explain the potential outcomes of a blunt cut and fringe, and propose a gradual approach or alternative styling options if the requested cut is deemed unsuitable or too drastic for an immediate change. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the barber to balance client expectations with their own professional judgment and the established standards of the profession. The client's request for a drastic change, while seemingly straightforward, can lead to undesirable outcomes if not executed with careful consideration of hair type, face shape, and the barber's skill set. Misinterpreting the client's desires or overestimating one's abilities can result in client dissatisfaction, damage to the barber's reputation, and potential regulatory issues if the service provided falls below acceptable standards of care. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing client consultation, professional assessment, and a phased approach to the haircut. This aligns with regulatory expectations for providing safe and competent services. Ethically, it upholds the principle of informed consent and client well-being by ensuring the client understands the implications of their request and that the barber is proceeding with a plan that is both achievable and in the client's best interest. This approach minimizes the risk of irreversible errors and allows for adjustments based on the client's reaction and the hair's behavior during the cut. Incorrect approaches analysis. Proceeding with the drastic cut without a thorough consultation or assessment is a regulatory failure because it bypasses the essential step of understanding the client's needs and assessing the feasibility of the request. Ethically, this is a failure of due diligence and could be considered negligence if the outcome is detrimental. Agreeing to the cut solely based on the client's insistence, without offering professional advice or suggesting alternatives, represents a failure to uphold professional standards. This can lead to client dissatisfaction and potential complaints, which could trigger regulatory review of the barber's practice. It also fails to educate the client on what is achievable and appropriate. Suggesting a compromise that significantly deviates from the client's stated desire without a clear rationale or offering to demonstrate the proposed change is also problematic. While compromise is important, it must be a collaborative process. Failing to explain the reasoning or offer a visual representation can lead to misunderstandings and a perception that the barber is not fully listening or is unwilling to meet the client's core request. Professional reasoning. Professionals should always begin with a comprehensive consultation to understand the client's vision, lifestyle, and hair history. This should be followed by a professional assessment of the hair type, texture, density, and the client's face shape to determine the most suitable haircutting techniques and styles. If a client's request is ambitious or potentially problematic, the professional should clearly communicate potential challenges, offer alternative solutions, and suggest a gradual approach if necessary. Documenting the consultation and the agreed-upon plan is also a crucial step in professional practice.